We're looking forward to sharing with you the important work that has been done over the course of the last little while to ensure that seniors are able to age with dignity, close to home, and within their communities. And I'd like to extend a big thank you to the folks at Dogwood Long-Term Care Home for hosting us today. Their long-term care homes provide professional care and supervision to adults in a supportive and secure environment. This place contributes immensely to strengthening the quality and safety of long-term care. It's now my pleasure and honor to introduce to you my good friend, the Honorable Mark Holland, Minister of Health. Minister Holland is a staunch advocate of all manner of things important, from marriage equality rights to helping to reform Canada's animal cruelty laws. And both in public and private roles, he has backed health-related initiatives, whether as Executive Director of the Heart and Stroke Foundation or as National Director of Children and Youth. Please join me today in welcoming Canada's Minister of Health, Mark Holland.
Thank you so much, Taleeb. It's a great pleasure to be here today, to be back in British Columbia. This is my 5th time in British Columbia in just 6 months. As Minister Dix and I are working very closely together on meeting the challenges that are facing our health system. And I think it's exactly what Canadians expect, that we all pull in the same direction. We're in a moment in time where, coming out of the pandemic, there was enormous stress placed on our health system in all aspects. And what that has meant is longer wait times. It's meant a challenge in terms of workforce. And when we're talking about our seniors and long-term care facilities and aging with dignity, Dan, I welcome you to this role. It's a big challenge, and we have an aging population, but we have to rise and meet that challenge. Just as the first agreement, bilateral agreement with working together was here in BC, the first agreement on aging with dignity in the country is here with British Columbia. Because British Columbia is doing phenomenal work and is a great example, I think, of how two governments of different political stripes can set aside differences and really get focused on getting things done. And when we look at what this agreement is going to be able to do in the next coming years to expand home and community services, how critical that is to open pathways for people to be able to age at home and have care at home as long as possible, making sure that when they do transition to a home care facility, to a place that is going to feel like home and is going to take very good care of them in a facility like what we're in here today. We see strengthening the safety and quality of long-term care generally in this agreement, an improvement to the quality of dementia care, increase access to palliative end-of-life care to people outside of hospitals, to personalize care, and make sure there's greater oversight, as well as tackling many of the issues that we've been talking about here and in Charlottetown as health ministers around workforce issues. Le financement accordé par cet accord aidera à la Colombie-Britannique d'élargir les services de soins à domicile et en milieu communautaire, renforcera la sécurité et la qualité de soins de longue durée, améliorer la qualité de soins pour les personnes qui ont la démence, et aussi augmenter l'accès aux soins palliatifs et de fin de vie pour les personnes qui sont en dehors d'hôpital. C'est un jour tellement important pour les années et certainement pour notre système de santé aujourd'hui. And that's why I'm so pleased to say that this agreement, some $733 million in federal funding, will work with British Columbia for their 5-year action plan on aging with dignity to deliver specific improvements to their healthcare system by 2029. The province will also be reporting on progress made on an annual basis. And this is a critical part of these plans to make sure that in the work that we do together, we have key metrics that we identify with CIHI so we can see the progress in our system. We can see specifically how these dollars are working, not just feeling them, but actually seeing them in data. And altogether, this is part of some $200 billion the federal government is investing in healthcare over the next 10 years. It includes $2.4 billion to improve access to home and community care and $3 billion for long-term care to provide for provinces and territories. As I said, that cooperation is absolutely critical because after a lifetime of hard work and contributing to society, it's essential that we're there for our seniors to make sure that they have the quality of life and the quality of care they so richly deserve. So it's a pleasure to be back here again. Adrian, I'm greatly appreciative of our relationship and the work that we've been able to get done. And I'm excited for Minister Dix to share in greater detail exactly what this agreement is going to mean for the province of British Columbia. Thanks so much.
Thank you. Thank you very much. And it's true, Minister Holland's been a frequent guest here to British Columbia in the last 6 months. And I think the work that we're doing together, both in this area of seniors care, the work we're doing together to support care in general in the community, the work we're doing together to ensure that children and youth are protected, as evidenced by the work that we've been doing on issues such as nicotine pouches and others, demonstrates a real commitment together, I think, to improving healthcare, both in the system and the health of Canadians. And I really appreciate all of the support we get. It's good to be here with Taleeb Noormohamed, this is his constituency. It's great to be here. It's great to be here at Dogwood, this beautiful new care home that reflects the very significant capital investment that British Columbia is making in seniors care right now across our province, which we believe makes a big difference. And I know Joanne Tate is here from Vancouver Coastal Health can testify to the impact that this facility has had on residents here at Dogwood, the change it brings to have beautiful single bed rooms that give people not just the care they need, but the dignity they need to live their full lives, even when, to a degree, because you're in long-term care, your body's let you down. This agreement's an important agreement, as Mark suggested. Minister Holland, can't be too familiar, right? This is a formal thing. As Minister Holland has suggested, we were the first to sign the main bilateral agreement with the federal government. British Columbia we're the first to sign this agreement because we want to get on with it. I know that Minister Holland wants to get on with it. I know my colleague Harwinder Sandhu will be speaking about wants to get on with it. We want to get on to making key improvements in the healthcare system, especially in this period as we've lived through the COVID-19 pandemic, which so affected seniors' care and the lives of seniors in BC and everywhere in Canada. And you can see it in the changing demographics of our country and our province in particular. We know that when we started public health care, life expectancy at 65 was about 12 or 13 years. Now it's 24 years. Life expectancy at 65, it continues to grow. We have challenges in that regard, but this is, of course, not a bad thing. It's a great thing. But we understand that the variety of care required, the variety of supports required in the community and then in long-term care increases when that happens. You see it in the community that's growing, such as Surrey, where we're going to see between now and 2038 a 240% increase in people over 80 and only an 18% increase in people under 18 in that time. Or in a different kind of community like Fort St. James, where the working population will decline over the next 10 years. We're building a new hospital there and care facility in Fort St. James. And the number of people over 75 in that community will increase by 186%. This agreement today reflects that changing society. And just to speak specifically to it, it has really two components. One is to support home and community care. And just to put that in context, the home and community care part, really home support is the key element of that, is an extension of the current agreement we have with the federal government in that regard, which has taken us from, which has helped us add by 13% from 124,000 to 139,000 number of people receiving home support and home care services in BC. But we're continuing that agreement. That's half of this agreement, essentially. The other half is truly incremental for long-term care. and will allow us to make specific increases and improvements both to the workforce in long-term care, because that's critical. We've been doing that, and you've seen the number of people working in long-term care increasing dramatically as we increase care standards, increasing dramatically as we make improvements for them. But that work has to continue as we build out more and more long-term care and raise the quality of care, which are both important commitments. So that is the second part of the agreement. So think of it as a per year agreement. That's about $81 million a year. And we're going to use that money to make significant improvements. One, to allow people to live longer at home and to make better preparation to go into long-term care, to improve, as Minister Holland has suggested, dementia care, and also to invest in our workforce. So workforce is necessary at the bedside to support seniors living in long-term care. I want to say that one of the reasons we wanted to be first, one of the reasons I think the Minister Holland is pushing so hard on these agreements, is that I think if we understand the experience of COVID-19, the impact in particular on people living in long-term care was profound. We saw this at lots of places in this city and in other communities. We saw it at the Little Mountain Care Home, and we saw it at the Holy Family Care Home, and we saw it at care homes across BC, such as the Acropolis Lodge in Prince Rupert. And I think that we have an obligation not just to increase the amount of care against an increasing population, but the quality of that care, to allow and to ensure that people live their life in long-term care to the fullest. This is something that my family understands personally because of our experience of family members in the pandemic. It's something that people involved in supporting long-term care understand. BC did a better job than any other jurisdiction in North America on long-term care, and still, the cost was enormous for everyone involved. And we have to engage now to do better. There is less attention on long-term care now than there was during the pandemic. But there is more need, in my view, to invest to support people living in long-term care. And that is what this part of the agreement is about. Support for the community, support for long-term care, the federal minister and the federal government working with the provincial government to increase and make improvements to the system. That is what we need to do. And I am very proud, and we'll look forward together to signing this agreement today. I'm also proud to acknowledge the member for Vernon Monashee, the parliamentary secretary, the parliamentary secretary for seniors in British Columbia. Harwinder Sandhu has done a remarkable job at advocating, and you see that reflected in this agreement. She's a nurse. She knows what these issues are about. She knows what it means to be discharged from a hospital into long-term care. She knows what it means to be delayed in that discharge. She knows what it means when the quality of care is not high enough and that returns back to the acute care hospital. And so it's my honor to introduce Harwinder at this time.
Good morning, everyone. Thank you, Minister Dix, for the very nice introduction. And thanks to MP Taleeb Noormohamed for having us here. And good morning, everyone. It is an exciting day. As Minister mentioned, I'm Harwinder Sandhu, a Parliamentary Secretary for Senior Services and Long-Term Care. And I'm happy to be here today. I too would like to acknowledge that with respect, history, customs, and cultures that we are gathered on the traditional lands of Musqueam, Squamish, and Tsleil-Waututh nations, and whose territories were gathered here today. It is wonderful for me to be here today after the official opening of this very beautiful place, Dogwood Care Home. Minister Dix and I were here in August, and it's beautiful, very spacious and inclusive home care. It provides home for more than 150 residents. And I know how exciting the day was when we were announcing, and it was in the midst of wildfires we were having. And I'm from the Okanagan, and many of the places here were trying to host some of the residents from our area. So it's a big day for people, especially for seniors and families, and having this partnership. And for me, having to work with Minister Adrian Dix, who's very focused and very keen, very dedicated to make not only acute care, but also long-term care better. And of course, we're grateful for Minister Holland and MP Taleeb Noormohamed for their partnership. This is what it looks like when we're working together. It's no matter which political stripes we hold, the end goal is to work for people's betterment, and that's how we can deliver results, which we can see today. And I also would like to congratulate our incoming seniors advocate, Dan Lewitt, who I look forward to working with you and it's a great work we have ahead of us and very important work. So congratulations. And of course, Joanne Tate for all she does. It's a teamwork. So I would like to acknowledge these wonderful human beings. So they really help us to do the work that we are committed to do. So today's announcement is about helping people in BC so they can age with dignity. As Minister Holland mentioned, that they contributed their entire life building this society and building our lives as well. So it is our turn to give back, and that's what we're doing. It is about supporting our seniors to live independently in their home for as long as they want and safely as possible. Again, my work, almost 19 years in healthcare, not only was in acute care, but I also did get to do community nursing. And I know the value of having palliative care access and how many people we were able to, and we will be able to help them to palliate at their home. It also relieves the congestion in emergency rooms, but not only that, people, seniors, they get the care and dignity where they wanted to, spend their end of those day of their life. So it's very, very significant. And it's about working with Indigenous partners as well to ensure that culturally appropriate healthcare and high quality senior services are accessible to is also First Nations as well, and their elders and communities. It is about investing in healthcare workers who provide compassionate and professional care of our seniors, who I say that all the healthcare professionals, you are the heartbeat of long-term care and acute care. Without you, we couldn't even function. We can have all the money and resources. So thank you to all of you, and let's give them a big round of applause. And we are here to provide you tools and technology that you need to provide the excellent care. And this agreement does emphasize improving access to palliative care, as I mentioned. So people may, they can spend time where they want and with dignity, and they have the resources that they need. And it is about supporting people through their mental health and addictions issues. Today's funding announcement sends a hopeful and positive message to seniors as well as to care providers, no matter how much, so much to their families and communities. You helped shape our province and our country, and your governments of all levels are here to support you. And as a parliamentary for senior services and long-term care, it is my commitment as well in my role to keep you all safer, healthier, and more comfortable. And I'm confident that the actions we're taking today will go long ways to meet the needs and demands of people in this province. So I would like to thank you all. Thanks to media as well for relaying this very good, positive, hopeful message to people. And thank and welcome to all the distinguished guests for being here, for making this announcement even better. So thanks for everybody for doing your part.
Well, thank you, Parliamentary Secretary Sandhu. I'd now like to introduce to all of us Venus Villaos, who is VCH's resident care aide, and she's going to share with us her own experiences. So Venus, over to you.
Thank you. I'm happy to be here today and excited about this announcement. As a healthcare provider, I recognize the importance of this agreement for residents and staff here at Dogwood, as well as the broader healthcare system. As a resident care aide every day, I work closely with our residents to ensure they are receiving the best care possible. We have a wonderful team who look forward to working here to meet all of our residents' healthcare needs. The team is compassionate and committed to delivering quality care. But when you do this type of work, you end up forging a connection with the people here that is much bigger than the tasks that make up the job. Sometimes it's as simple as asking them about their day, and taking a moment to sit down and listen to story or spending time to meet their family visits. After years of supporting residents of Dogwood and in long-term care, this is home and this is family. I've dedicated my career to helping others, and I want to continue to do so in a safe, positive, and caring environment that considers the needs of staff and the residents who live here. Today's announcement, which ensures stable funding and supports in place for long-term care, lets me know that my work and my profession are valued. It inspires me to keep coming back and making those connections. At VCH, our shared values are caring for everyone, always learning and striving for better results. These announcements will help us, all of us here at Dogwood, at long-term care sites throughout the region, continue to live those values and deliver an exceptional care experience for all. I'm thrilled to be a part of this opportunity to enhance care for long-term care residents here and across the province. Thank you kindly.
Well, thank you very much, Venus. It's folks like you that make the real difference in the care of all the seniors in this province and across the country who need that support and that help. What you're doing is making an immediate and positive impact on people. You know, as a local member of parliament for Vancouver Granville, over the past 2 years, I've been working like MPs across this country and MLAs across this country to make sure that issues like this of long-term care, of taking care of our seniors, is something that we prioritize. And the members of my seniors council are actually here today, some of them. And their advice on policy advancements, their advice on how seniors can age in place with dignity, how we can take care of our seniors, has to be reflected in public policy. And what you're seeing today is a reflection of all of that work that is being done across the province and across this country in making sure that seniors' needs are best reflected in the decisions that are made in terms of healthcare. And we're looking forward to working closely with them and with all of us on ensuring that seniors can continue to age with dignity, close to home within their communities in ways that they truly deserve. You know, seniors, as we heard from the parliamentary secretary, have spent their lives working hard in this country and for this country, and we owe it to them to ensure that they are safe, that they are secure, that they're supported and living well. And, you know, as a British Columbia MP, I'm particularly grateful that we have a federal government and an incredible partner in Minister Dix and Premier Eby when it comes to making, particularly around healthcare, some of these things come to life. And, you know, British Columbia has been a leader and continues to lead in so many ways, and being able to partner is such an important part of, as you've heard from everyone today, in getting these things right. This is an important announcement for seniors in this province and in communities like Vancouver Granville and places like Dogwood. And we're going to make sure we do more and more of this and make sure that the voices of seniors are heard and front and center in the decisions that we make, so that them and their families know that each and every one of us are working hard for them. With that, that concludes today's announcement. I'm now going to pass the microphone over to Chris, who is going to take media Q&A. Chris, over to you.
Hi, everyone. So we'll start with the questions in the room. As usual, one question, one follow-up. If you can just state your name, your outlet, and who the question is directed towards. The microphone's right there on the left. You just form a line.
Hi, this is for Minister Dix, Cecilia from City News. You mentioned numbers on how the population of over 80 is going to increase by over 200% in the next couple of years. Could you just clarify those numbers?
Well, in that case, I was talking about Surrey, right? So we're seeing a very significant increase in that community. Surrey's often a bellwether in terms of everything, but in terms of healthcare as well. Mm-hmm. But Surrey traditionally, for example, has been, in the next 20 years, we expect to become the biggest city in BC, supplanting Vancouver. Surrey has traditionally been a younger city. And so a lot of the public policy issues in Surrey have been around, for example, education and other issues. And well, healthcare has a critical priority. It has been a younger community. What you're going to see in Surrey is a return to the mean of population distribution, which means that they're going to get a significant seniors population in Surrey and a growing seniors population. We have to respond to that. It's why we're building a second hospital in Surrey. It's why we're building a long-term care home with a nonprofit organization, PICS, that hadn't been done for a decade. It's why we're adding a medical school in Surrey. It's why we're taking 30 actions at Surrey Memorial Hospital to improve services there. Because Surrey historically has been below the the national average in terms of key indicators, and we've got to respond to that. Equally, in many parts of rural BC, you say the same thing. So we often talk about Surrey, but I gave example of a community such as Fort St. James, where you're going to see 185% increase of people over 75, and a decline in the working age population. So if you're going to continue to have the community function really well, in that case, you're going to have to recruit very effectively to the healthcare system, amongst other things, but not just the healthcare system, but all the services and industries that are in that region. So what we're seeing is an aging population, and that's two examples of those increases. We've seen a dramatic, and we're going to see a continued dramatic across-the-board increase in the number of seniors in BC. We're now see a seniors population which is larger than the population of youth and children in BC, and that's going to continue to grow. And again, this is not a bad thing. It's a good thing for all of us, especially those of us who are, in my case, nearing 60, right? And in my case, it's a good thing that life expectancy is increasing. But it means not just improvements need to be made in the highest levels of care, such as long-term care, but supports across the community, so that there are adult day programs, so that there are community in place, supports in the communities to allow people to live life to the fullest, not just live longer, but live better through that time. And that's why agreements such as this are so important.
Thank you.
Hi there, Yann Lacoste, also for Mr. Dix, Radio-Canada, CBC French.
Bonjour.
Bonjour, Monsieur Dix, merci.
Salut.
Question classique, voilà. Est-ce que vous pouvez globalement nous répéter en français pourquoi c'est important d'avoir cette annonce?
Oui, premièrement, je pense que le ministre Holland peut ajouter à ceci. Je pense qu'on est bien heureux d'annoncer que la Colombie-Britannique et le Canada nous sommes les premiers de signer cette entente, cet nouvel accord de financement bilatéral avec Santé Canada. C'est important, c'est essentiel. Cette entente va soutenir des personnes âgées, leurs proches, les travailleurs de la santé qui s'occupent d'eux et notre province dans son ensemble. Je pense que ce qu'on voit, c'est que cette entente apporte 733 millions de dollars sur 5 ans. Bien entendu. Donc, c'est une augmentation importante. Pour les soins dans la communauté, c'est un peu jeu égal parce qu'on a une entente déjà. Mais pour des gens qui ont besoin des maisons de soins pour des personnes de troisième âge, des personnes âgées en général, ou de long-term care, comme on dit, c'est important parce que c'est 81 $ additionnels. Et cela va nous aider à promouvoir des services et nous de faire des investissements dans nos employés et d'ajouter des employés parce que c'est essentiel. Quand on a une campagne de capital de 2 milliards de dollars, c'est important de construire des nouvelles maisons, mais c'est aussi essentiel d'avoir, bien entendu, des travailleurs là-dedans.
Certainement. Dans une question, il y a quelques organismes communautaires qui ont des projets pour aider les personnes âgées. Est-ce que cet argent pourrait aller potentiellement dans du financement pour des trucs comme ça ou c'est séparé?
Oui, mais cette entente représente à peu près 2% des dépenses actuelles dans le domaine, n'est-ce pas? Nos soins communautaires et le système de long-term care en Colombie-Britannique. Donc, cela va ajouter à cela. Mais déjà, on fait un tas de choses, n'est-ce pas? Déjà, on a un programme de capital le plus important de l'histoire de la province. Pendant les 10 ans avant que je suis devenu ministre de la Santé, on a dépensé à peu près 17 millions de dollars pendant 10 ans pour les long-term care homes, pour le capital. Nous avons un investissement de plus de 2 milliards de dollars, soit 184 fois plus important qu'avant que je suis devenu ministre de la Santé. Donc, c'était important d'avoir continué à travailler avec les organisations non lucratives pour ajouter des opportunités, comme à Surrey avec PICS.
Merci beaucoup.
Merci.
Thank you.
Hello.
Penny,
Hi, it's Penny from CTV News. My first question is for Minister Holland, actually.
you're back.
I just wanted to ask you, Minister, what is your measure of success and what do you expect to get out of these dollars that the federal government is contributing? Is there a certain number of beds? Is there a certain number of staff you expect to see hired? What would you like to see specifically done with this money?
Well, I think one of the things that's really important in the agreements that we've been signing across the country, first with the working together agreements, and now starting here with the Aging with Dignity agreements, is to have specific indicators of sort of success and to be able to demonstrate in those indicators, how we're doing and how things are moving. So the provinces, of course, are responsible for the administration of their health system. Our job is to be supportive in meeting their objectives. And I think by setting out those common indicators, we can see movement in the health system in a positive direction. We do have one of the best health systems in the world, but like all health systems out there, the pandemic placed it under severe stress. And I think what we saw in the pandemic, in the height of those darkest moments, was everybody working together in common cause and common purpose. And that's what we're trying to do here. So it's not for us to say to the province, achieve X or Y or Z. It's more about how do we work commonly to set these indicators, which are developed with CIHI, and then make sure that those are available and some people can see how their province is doing and how other provinces are doing.
Second question is for both the ministers, and it's more just around, this health human resources issue. There's a huge labor shortage in every single sector. Is there any discussion right now of out of the box thinking? I know there's been a lot of improvement on collective agreements and all sorts of stuff, but I mean, is it connecting housing for rural communities where a healthcare worker can walk into a job and an apartment and they're not looking at this, or looking at other options to make these jobs more attractive for people, because this is not a sector where AI is going to be able to help too much. It really does come down to hands, to faces, one-on-one with people. And so I just wonder, are there any discussions for really big thinking for how to address that?
Sure, and you're absolutely right. I mean, these are jobs that we require human beings for. And that direct person-to-person care is absolutely critical. I mean, we're talking about seniors here today. That ability to have that direct personalized care is everything. And I have to say, when we got together in Charlottetown and met as health ministers across the country, most of our time in Charlottetown was talking about health workforce issues. How can we make it easier for folks to move to different parts of the country to be able to meet needs that way? The service commitment we made to reduce to 90 days the recognition of foreign credentials. The announcement I made a couple of months ago with the Royal College of Physicians and Surgeons around vastly reducing their times to process and to bring people to market. The work that we're doing in immigration to bring those folks forward, and frankly, these agreements themselves, which are placing additional dollars on the table to help bring the people that we need. And then the last point that's under that is to, with a center of excellence, make sure that we're constantly forecasting for what future needs are going to be so that we don't wind up in this circumstance again. We have to make sure that as we get out of this crisis, and we will, and we are, that we don't wind up in this circumstance again where we're doing proper planning and forecasting to help one another to make sure that we meet workforce needs as our population. But I have every confidence with all of these changes and all the work that we're doing together that we're meeting this challenge and we're going to be able to tackle it. But I'll turn it over to Minister Dix for additional comments.
Absolutely. It's at the center of everything we do. Since I've been Minister of Health, there are 38,000 people working in healthcare. When I go around and talk to people in healthcare, they would say, all of them would say, we accept that that's the case and that it's not enough. We have to continue to add people in the healthcare system. How do you do it? Some are what we call the ways we've always done it, increased training spaces. So in our case, in the last year, more than 600 new spaces a year for nurses, 128 new spaces at the UBC Medical School, a new SFU Medical School, 336 new spaces for allied health professionals, an HCAP program, which is really important in long-term care, where we've added more than 7,000 people to long-term care and home support in partnership with the BC care providers. I think it's one of the things that I'm most proud of is the work that we've done together. My predecessor, but also the head of the care providers, Dr. Terry Lake is here, and Terry and and I have been working on these very questions, and the very success of that program depended on people working together. And I think that was the BC advantage during the pandemic, was that all providers, public and private providers who provide public bed working together. So more training spaces. We've got to improve pathways for internationally educated doctors and nurses and healthcare professionals, and we are doing that. This past year, I think it was 750 new doctors who are internationally educated, about half of them family doctors, about half of them specialists. Changes like the changes we've made in terms of standards around internal medicine, which made a difference in particular in the Fraser Health Authority. So we have to do that. I think we have to improve the efficiency of our healthcare system, ensure all our healthcare professionals work to the full extent of their skills. And, we've gone in BC, we've tripled the number of nurse practitioners in our system. And in BC, nurse practitioners play a key role in primary care, unlike many other jurisdictions where it's much more disproportionately on the acute side for nurse practitioners. But in addition to that, in the last year, you've seen the changes in scope of practice for pharmacists, and hundreds of thousands of people in BC benefiting it. And that required compromise and coming together of health professionals who I think would have been reluctant to do that in the past and are now doing that, right? So, and you see the addition and the recognition, for example, of other categories of workers like associate physicians and physician assistants. So we have to do it all. And in addition, technology will, of course, improve and provide better care. And we have to, but we have to consistently do, whether it's AI or anything else, is ensure that that technology is put in the hands of healthcare professionals to improve care and empowers patients as well, which frequently doesn't happen. I believe that remote care can really benefit people in rural communities, but sometimes it feels like it doesn't. It leads to even more centralization of care. And so I think there's great opportunity for all of that. But the answer is not that we have to do one thing. The answer is we have to do all of those things and more. And I think there's a real commitment here in the work that Minister Holland and Health Canada is doing, working with us, and really banging on the door of his colleague ministers of immigration, I think, which is what Minister Holland has been doing. That doesn't happen in public, but is critically important, because one of the differences between ourselves and, say, Australia is that there are more constraints in healthcare professionals coming to Canada at both levels of government. We've taken a lot of action with the colleges here to change that, and the federal government is doing the same thing, and I think those are some of the ways you'll see change. Are we going on the phone? Are we going on the phone? I think.
Yeah. We can turn it over to Josh, who will do the virtual Q&A.
Thanks, Chris. If you're a journalist on the Zoom and want to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I've stated it, please indicate your name and media outlet before asking your question and state to whom your question is directed. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question et indiquer à qui vous posez votre question. Okay, so first up, we have Rob Shaw. Go ahead, Rob.
Hi there. Minister Dix, hoping to ask you, in the agreement, which I was just reading, there is a mention of virtual care pilot project for long-term care homes, monitoring seniors in their house virtually with geofencing and fall detection and that type of thing. Can you talk a bit about why BC is interested in using the federal money to do this?
I think what's important is not just that moment, and that moment can take a while. When someone makes a transition, for example, from home to long-term care, it sometimes happens via a hospital to long-term care. But there are ways, I think, that we can extend that time and support seniors at home. We want to explore that. We want to explore the ability to extend the time people live at home where they often prefer to be, and support them through both technology and through direct support. So that's one of the things that we're looking at with the federal government, with the federal money, is to essentially extend for those people who are either waiting for a long-term care bed or are not yet essentially qualified or meeting the standard to need long-term care, but need some support. So we want to improve our ability to provide care in community. And that just makes sense, I think, for everyone involved. It sure makes sense for a lot of families because it is a very difficult moment, the moment to make that transition from home to long-term care. We want to extend out that time people can live at home and live as they have been living the rest of their lives, and also to provide supports in doing it. I think there's real opportunities. We've been trying to do some of the same work on the acute care side with hospital at home. In other words, providing supports in the home that allow for an avoidance of time in hospital or an earlier discharge from the hospital, so we can provide people the ability to recover in homes, which is sometimes for them safer and usually better.
Could I follow up with a question to Minister Holland?
Absolutely. We're both here.
Okay.
Waiting for you, Rob.
Last week, Minister Dix and our Premier announced they were going to move oral tobacco pouches like Zonic to sale behind pharmacist counters so that youth could have a harder time purchasing them because there's a problem here. You've mentioned Canada was kind of duped into approving this when it's marketed for kids. Are you going to put an age limit on products like this? And if so, when is that happening?
Well, first of all, I commend Minister Dix in British Columbia for taking the action they have. I think it's entirely appropriate that these products be moved behind counter. What we don't want to see happen is frankly what we saw with vaping, where we had a whole new cohort of young people becoming addicted to nicotine who weren't smokers and were using this as a new delivery mechanism for nicotine. And yes, the tobacco industry is wily. They're looking for opportunities to addict people to nicotine, and that has devastating public health implications. So in the coming days, we're going to be ready to announce our action federally and what we're going to be doing. I'm not in a position just quite yet to go into greater detail, but I can say that I'm very supportive of what was done here in British Columbia.
Next up is Pawson on the Zoom.
Yeah, hello, ministers. If you could maybe both respond to this in French and English, please. There is a vote at Richmond City Council tonight. That city is looking to create a process by which to set up a supervised injection site. It's facing some significant opposition in the community. So I would just hope that you both could address in French and English the utility of safe injection sites and how you may support that in cities like Richmond and across Canada. Thank you.
Well, we're facing an absolutely terrifying crisis when it comes to opioids. And we're seeing in different parts of the country, and certainly it's been the case in British Columbia, a situation that is, very dire. A lot of lives are being lost. A lot of tragedy is unfolding. And so we have to work together to find solutions. Again, healthcare, of course, is administered by the provinces. I see the federal government as playing a convening role to be able to take a look at what is working and what is successful in different jurisdictions and try to bring folks together. And a lot of this is nascent. The size and scope of this problem, as opioids have become more prevalent in the form of fentanyl and carfentanil and these very easy to deliver and highly toxic drugs are deeply concerning. So, I wouldn't have a comment on something as specific as a local council decision. I would leave that to Minister Dix, but in a broad sense, we're here to support in any way that we can. C'est un enjeu, c'est vraiment une crise. Et c'est absolument important de chercher pour toutes les solutions possibles et de collaborer avec toutes les provinces et territoires pour trouver des bonnes réponses pour les crises avec les opioïdes. Et ça m'inquiète beaucoup. Mais j'appuie totalement l'action du gouvernement de Colombie-Britannique. Peut-être Ministre Dix pourrait dire quelque chose d'additionnel.
Oui, premièrement, en français, je dirais que c'est notre devoir, bien entendu, de travailler avec les villes, les municipalités dans ce domaine. Cela étant, il est forcé de reconnaître que la qualité et l'importance de cette question est centrale pour nous. Et il faut utiliser tous les moyens, premièrement, pour assurer que des gens continuent à vivre, ce qui est essentiel. Et c'est ce dont on parle quand on parle de safe injection, quand on parle de limiter l'effet des poisons dans notre société qui sont distribués un peu partout. Et évidemment, de prendre l'action avec des gens qui sont des distributeurs de drogue et d'une manière importante par les polices et par d'autres. Et finalement, pour assurer que des gens ont accès pour le traitement, ce qui est essentiel. Donc, il y a pas une réponse, mais plusieurs. Je pense quand on parle des sites comme on va parler à Richmond ce soir, je pense qu'il faut se reconnaître leur effet positif en général pour la société, l'efficacité de Vancouver Coastal Health qui a ouvert beaucoup d'endroits dans les communautés et qui a un bilan important de protéger des gens. Et il faut reconnaître cela et on va continuer à agir de protéger les gens et aussi de promouvoir des programmes de traitement. In this area, and obviously the principal responsibility is my colleague, the Minister of Mental Health and Addictions, Jennifer Whiteside. I just say the following: you need not just one response to what is a central crisis, a central issue of our time, which is a poison drug supply and its impact on everybody, young people, but everybody in every community in BC. You need a number of actions. First of all, you need to keep people alive. And that means taking actions to give people access to prescribed safe supply. It means actions to ensure that they're safe. Vancouver Coastal Health has, as everyone knows, an exceptional record in supporting safe injection sites and saving lives. The record is a record that is, I think, well understood as excellent. And that's critical. We also need, in addition to those things, treatment facilities for people, because that and that's why you've seen the significant expansion of treatment that we've seen in BC and are going to continue to see. And you're going to take action against drug organizations and dealers who are peddling poison to people in our province. There's not one answer, but it's all those answers and more. You need action as we're taking on housing, for example, expanding access to housing in our province. You know, the impact of the COVID-19 pandemic on the public health emergency was actually declared by my predecessor, Terry Lake, and Dr. Henry's predecessor, Dr. Kendall, as provincial health officer, has had such a profound impact over time. And so it requires a comprehensive response, and that's what we're providing. And that's safe injection sites are part of that, but only part of that solution.
Do you have a follow-up?
Yeah, thank you. Minister Dix, could you address, though, that it seems like the experience in a place like Richmond, hearing from Kashid today, is that there is this ongoing stigma, this ongoing understanding that if you had one of these tools, a safe injection site, as you mentioned, it will bring problems to your community. That's the feedback we're hearing of the community opposition, that bringing in a tool like a safe consumption site would bring harms to the community. Could you respond to that? French and English, please.
I just respond with the evidence. First of all, the evidence is that safe injection sites save lives. The evidence is that they make a difference in communities. The evidence is they make communities safer. That doesn't mean there isn't a debate. You always have to, when you're doing something that may be perceived as new and different, and this is not new and different in our province. It's something that's been supported by the current government and the previous government, by myself and my predecessor as Minister of Health. When you're talking about this change, and expanding access to these changes, you do have to engage with communities. That's precisely what Vancouver Coastal Health is doing with this and every other community. But the record of safety in safe injection sites is remarkable. There is enormous evidence to its positive effects. But what is a fair comment on it is that you need safe injection sites and you need treatment, and you need action against about a poison drug supply, and you need action against dealing poison in our community. And you need better access to housing to allow people the housing they need to get better and to make treatment effective in community. These are chronic diseases that affect our communities, many young people and many others. They're much more like my type 1 diabetes than they are, which I will have and deal with for the rest of my life. And that means you require supports in communities and engagement in communities for people who are going to live in communities with their addictions for decades. And we need to take all of those actions. What we have with safe injection sites is a model that has proven its safety and its effectiveness. And what we have to do is, of course, continue to work with communities to demonstrate that evidence and to work with them to ensure that that people living with addictions are safe. It's surely something that we all want, which is people to have an opportunity to be safe and be alive. So without those things, of course, there's not a future. Je dirais la même chose en français, que c'est essentiel de répondre avec toutes les réponses possibles à cette crise d'urgence dans notre pays, dans notre province. Et donc, il faut utiliser tout ce qui est à notre disposition. Et ça veut dire d'assurer que les gens restent à vie. Le bilan des safe injection sites en Colombie-Britannique est un bilan de protection pour des gens. Mais il faut, et je pense que c'est le cas à Richmond et ailleurs, présenter cette évidence et on va continuer de le faire.
Thank you. So that's all the time we have for questions today. We'll now move on to the signing ceremony.
Woohoo! We're signing. Thank you. I'm not kind of on my work. You can come around, you guys talk together and that's all. That's right, isn't it? They got all right.